So certainly, as we're talking about, as we launched, I was sharing that happy to share information about this. The MSL Society worked with these 22 global MSL leaders, as well as the certification industry's testing leader to help launch this program. And certainly all of this was based on international certification industry standards. The other thing that is exciting to share that just within a couple of months since we've launched the certification program, there are now over 70 companies that have MSL professionals who have earned the MSL-BC credential. So before we get started, I just want to share a couple of technical details. As participants, you can hear us, but we can't hear you. However, in your control panel, you'll notice you have a question panel. We encourage you to type questions or comments throughout our presentation today. And then also another technical detail for anyone who might be experiencing difficulty hearing us, make sure that your volume on your computer or headset is turned all the way up, and the same for anyone dialing in. We've also been asked by several people if we're going to record this. Yes, we are recording this, and we will have it available on the MSL Society website for everyone, not just members, very soon. We just need a few days to get it up on the website. So I wanted to, before we get into our panel discussion, there is a lot of questions around eligibility. What is this? So this is a traditional certification. And so there are some specific eligibility requirements. In this case, it is a bachelor's degree or higher from a regionally accredited educational institution, and 1 year of cumulative experience working as an MSL or leading an MSL team. So let me just be very clear from the beginning, this is not available for aspiring MSLs. It would seem a little ridiculous for somebody to be able to get certified as an MSL and they've never actually done the role. So that's what it was decided, and that's pretty standard for professional certifications. A little more details about the exam, because there was a lot of questions about this. The exam consists of 140 multiple choice questions. In order to pass the exam, you must answer 86 of the 125 questions. Reason why 125 is because 15 of the 140 are pre-test questions, and nobody would know what those questions are. That's actually standard as well for certifications, and that's for cut score and some other psychometrician technical details as we evolve the exam and there's new forms being rolled out. You have a total of 4 hours to complete the exam. The exam is virtual, but can complete it at home or office. And it will be administered through the MSL Society's Learning Management System, or LMS, but it will be proctored live. So when you're taking the exam, the person who's proctoring it will see you, you will see them. And so there's some very strict guidelines and rules when you're taking the exam that all are aligned with international standards for certifications. A couple other things, the recertification, don't really need to worry about that too much now, but it is a 3-year recertification program. Just like other credible certification programs, there is a recertification process. Ours is a 3-year, and basically there is 2 options to do that. You either retake the exam, or there is continuing education credits, which are being developed right now. So examination fees, there was a lot of questions about this. It's all on the website. I keep having the URL on the bottom of these screens. You can see that. So the fees are $450 for members of the MSL Society. Non-members is $550. And again, this is for a 3-year recertification cycle. So this would be for 3 years, not each year. And then finally, we've had a lot of people ask us about prep course. We are creating and developing some things. They will be available soon, but it's really important that you understand, just like any other credible certification program, these would not be required. These are prep courses. These are ancillary materials that are completely optional. They're not related to the MSL-BC exam in terms of being a requirement. They cannot be that, and that also is international standards. Those standards dictate they cannot be a part of it. So the only thing that the MSL-BC is an exam. So we'll get into a lot of that as well. We created with a certification lawyer, all of the people that were helping develop this, and one of the industry experts who we would term, to use lingo in the MSL space, one of our KOLs, or the KOL in the certification industry. We spent probably more than 6 months on the certification handbook alone. It's very detailed. I would encourage you to download it. There's a lot of information there that that you'll be able to decipher from that. So that leads us to and brings us to our panel discussion today. Since being launched a few months ago, as I mentioned, more than 70 companies have MSL professionals that have earned the MSL-BC credential. And interestingly, there are now many managers that have a preference in hiring MSL-BC credentialed professionals. So our panel today includes 2 of those MSL leaders that have taken the MSL board certification exam themselves, and as a result have a hiring preference in hiring MSL-BC credentialed professionals. So I'm going to be joined in our panel today by Dr. Larry Dollar, who is the VP of Global Medical at Syneos, and Jihad Riscala, who is the Director of MSLs at Synovium. And for those who know Jihad, he goes by JR, so that's what I'll be referring to him today as. So Larry, JR, thank you very much for joining me today.
Thanks for having us.
Thanks, Samuel. My pleasure.
Pleasure's mine. And we have several questions we want to discuss today. And for all of you listening, again, please type in your questions in the chat as well, and we'll try to get it to as many of them as possible. At the end of our discussion with both Larry and JR, I have a few of the most frequently asked questions on a slide that will address those as well. So let's get into this. And sorry about the technical issue in the very beginning there. This is what happens when you do these things live. So I'm going to start, Larry, with you, and I'd like both of you to address this. So here we are. We're talking about the MSL-BC. Both of you have extensive experience and leadership within the MSL space. And I'd like both of you to address this, but Larry, I'm going to have you first. Why did you decide to take the MSL-BC exam?
Yeah, sure. Thanks, Samuel. I think for me, I'm always very interested in doing whatever I can to continue to help our profession grow and develop and up the credibility, if you will, across the organization. And again, as this profession continues to grow and definitely has become really one of the components of industry that has grown, I was interested in doing whatever I could to help continue to further exemplify the integrity and professionalism of our role. And then secondly, I think as managers or really senior leaders in any organization, you always want to feel comfortable in asking your team to do anything that you've experienced or gone through. So I thought those two things combined with the opportunity for some continued growth and development were things that really encouraged me to take the exam.
Excellent, excellent. And we're going to get into a lot of other, for all of you listening on the call, all the questions that we certainly had mentioned, discussion points, we're going to get into all of those. JR, tell us why did you take the MSL-BC exam? Again, knowing that, just like Larry, you have extensive experience in the space.
Thanks, Samuel. I agree with Larry's thoughts about why he took it, and fully. For me, it was that plus a couple of other things. One, to be honest, it was curiosity. I've been in this field for a little over 20, 22 years. And I guess for me, it was more of a point to see how much I know. Am I good at it? Have I done enough to bring myself forward, develop my skill, be at the level where as a senior leader and as a coach and as a manager, I have all the requirement needed. Plus, let's face it, in our profession and other profession like MDs and fellows and what have you, a lot of these people get also accreditation and they get a fellowship title after their name or some other titles that increase their value, make them more expert in the field and more credible. So to me, it was knowing how much I know and whether this is going to actually add value to me so I can help others. And the other thing is really, I was curious about the test. We all hear about different processes and knowledge. We all get training, we get onboard training, but do we actually get the right training? And to me, it was a curiosity when I took the test to know what it's intended for, what was the content, and to be honest, it was just perfect. I mean, I was very, I can talk later about it, but I was very impressed.
Excellent. Thank you for sharing that. And JR, just a little bit of we got a little bit of interference for you, just FYI. I think it was fading in and out, but I know other people are going to be asking me about that. But just FYI. Thank you for that. I want to talk about that a little bit because I think both of you have unique perspectives on this. Let's talk about the impression of the actual exam, Larry. And I'm gonna jump back over to you. I mean, I think you had some funny perspectives, and just give us, just very candid feedback. What was your impression of the MSL-BC exam, and what was the tell us about your experience and impression with the exam.
Yeah, sure, Samuel. I think as you highlighted at the beginning of the conference today, looking at the caliber of the medical affairs leaders and participants that helped develop the exam and their reputation within our industry, I knew that it would be a very high caliber and rather challenging endeavor. And so I was motivated by that. I was also a little bit concerned that as JR said, could I get it done and could I get it accomplished? And so I think when you look at a lot of the work that you and your team did based on the number of content areas that are highlighted in the exam with the internal, external stakeholder engagements, as well as really what that MSL compliance component is. On top of that, you zeroed in on kind of the top 14 MSL tasks, and then you even went further and you talked specifically about 60 different steps and daily tasks, if you will, that MSLs are involved with. So my impression was that the test was very complete. The test was really a true snapshot of what the life of an MSL is, and was very complete from compliance to statistics to all those different parameters that are outlined and we need to be experts on in our role.
Yeah, absolutely. Thanks for that. JR, what was your impression of the exam?
I agree totally with Larry. To me, being in medical school and going through a lot of certification and exam and CME, I want to say it was probably one of the hardest tests I have taken, even with my knowledge of 20 plus years. I was concerned, actually, I was going to pass, to be honest. It was so complete that only somebody who's been in that role can really understand and able to answer most of the question, maybe not all of the question, because the life experience that you have as in this role encompassed a lot of things, and the test pretty much covered almost everything. One thing I have to say, to me, it was actually brutal, because the way it was proctored and following the international guidelines, and the way they want you to sit in front of your desk and show the room and the four walls and really have an eye on you for the entire 4 hours was pretty interesting. And I'm like trying to focus on answering the question, but at the time thinking that they're watching me and I cannot do anything else except take the test. So from integrity and credibility perspective, it was tremendous. And I learned a lot. I missed some questions that I had to go back and look at. But again, unless you have done that role and you have really experienced, the skills and the content was phenomenal. And I encourage anybody to take that test, because they really learn a lot of things about the role and about themselves.
Excellent. Yeah, thank you for that candid feedback. Larry, did you have any other comments on that?
No, I agree. I think those of us that, especially now that we've adapted into this virtual environment for the work that we're doing, just as you gear up for that exam, just as JR said, keep that in mind that, ideally they want you to be at your desk and no bathroom breaks and limited snacks and drinks on your desk, as well as the space has to be cleared. So the level of integrity and the level of scrutiny to really provide a true testing environment is there. And again, it's definitely one of those things where when you finish the exam, you're maybe not quite so sure how things went, and so it was definitely very rigorous.
Jared, do you have a comment? Do you have something else you were going to say?
Yeah, I actually was going to say, don't think you can let a colleague take it for you. Those people are really strict. You have to show your ID on the camera, show your picture ID to know that it's exactly you. So no cheating.
Yeah, no cheating. So, and it's clearly by design, right? I mean, we've followed every international standard. I mean, this was not something we came up with. This was what was recommended. Beyond the process, though, can you just both quickly talk about, and you both kind of alluded to it, but I guess want to be very direct. I mean, do you feel like that the exam tested what is truly applicable to MSLs across all levels? I mean, do you think it's valid and reliable from that standpoint, JR?
Absolutely, Sam. I mean, let's face it, if you look at the individual who helped put the test together, our colleagues who are leaders in the industry who've done this for years really know the role. And from the question that I answered and the subject that covered, our role has expanded so much over the last 20 years that I've been in this business. There is so much new you need to learn and know and add to your skills. And that test covered all the bases for me, which made me very excited about it.
Yep, absolutely. Larry, any comments on that?
No, I felt like the test was extremely complete and a true reflection of what the role is. There are, as JR said, so many things that are reflective of what we do, and those 60 or so activities that I really thought the team did a fabulous job of highlighting those. And I think a couple of issues before in the MSL journal, Cherie Hyder did a really nice job in outlining those individual areas. It's a nice reference for people to go back and help from a preparation. And I know you mentioned the guidebook too, Samuel, is another great reference. It'll be good for people to kind of get level set about what areas maybe they need to spend a little bit more time in the preparation part.
Yeah, absolutely. I want to jump into another question that I had that I wanted you guys to talk about, and I definitely want to take some comments and questions from the audience. So anybody who's listening, please comment. And what I'm going to do is I'm going to just mention your first name, not your last name, and the question, and I'm going to read it verbatim. certainly anybody has any comments or questions, please just certainly add it in here. So this one, there's actually a comment here from somebody, and I think it really goes into the next point I wanted you guys both to discuss anyway. So Ivan has said, not a question, but a comment. It seems very odd to offer to do this test after having a year of experience as an MSL. The logic here is invalid. And then, so I guess my question is, I'd like for you guys to talk about that, but then talk about from your perspective. I think it really goes into why is the MSL-BC important to the MSL profession? So JR, can I have you talk about those two first?
Absolutely. I mean, back to the comment from Ivan, having taken the test and being in this profession for over 20 years, I don't think anybody who has never done the role and just read the book or went online and learned about it can actually answer these questions. These are questions for an individual who is skilled at the role, who have done it, who understand it, who understand the law, the compliance, the ethics, how to work with commercial, how to analyze data, how to present it. I mean, I can go on forever. I don't think anybody who's never done this role is capable to take that test. That's my personal opinion. Number two, about the question, and can you remind me, Sam, what was your question?
Yeah. So Ivan was asking, after a year of experience as an MSL, right? Why would you do this? And I guess the question I had for both of you is why is the MSL-BC important to the profession?
Well, like every other profession in this world, scientists always have to be prepared to take additional skills. A lot of them get certified all over the place, whether it's a neurologist, a psychiatrist, a psychologist. They all have to get accreditation to the skills to show that they are credible and they have experience and highly skilled in that profession. Same thing with the MSL. The MSL is the front line of an organization and industry to share scientific data in a credible way with high integrity and be able to help patients use specific medication. So unless you're up to the role and you have done it for a while, and a year actually, most of us managers spend a lot of time the first year with MSLs, coaching them, developing them, helping them with the data and preparing them for the next role. And that's where they gain all that knowledge to be able to, one, take the test, and two, show their credibility and their skills.
Yep, absolutely. Larry, any thoughts on that? Again, it was a compound question, but Ivan is asking, very odd to offer to do this test after having a year of experience. And also, why is this, why is the MSL-BC important for the profession?
Yeah, I think the second question first, Samuel, in terms of why it's important to our profession, I'll use the boating analogy of if we're not moving forward and you don't have any, either your rowing or your motor's not moving your boat forward, you're gonna become adrift. And I think this is an opportunity to have continuous improvement in our profession. I think we, in MSL and medical affairs teams, we have certification processes when new data comes out that we actually have to certify for the scientific information around the data. We spend lots of times at companies with some of those softer skills, with difficult conversations and self-awareness and those types of improvements through some of those behavioral and those types of classes. But we really haven't up until now had an opportunity for us to specifically focus on an improvement process for our own profession. So I think that's why it's important. It adds a level of, I think, integrity and really an accomplishment, if you will, to the role. I think secondly, as JR pointed out, many other roles, whether you're in financial planning or the board certification process in pharmacy or multiple other roles have certification processes. So So I think it helps our profession by having something that we can definitely anchor on across the board. And I think there's no good teacher, or even there's no better teacher, if you will, than experience. And so I think actually the opportunity to do the role and be in the role, sometimes people can feel comfortable within 6 months. Sometimes it takes a year. Sometimes it takes 2 to 3 years before the nuance, depending on what therapeutic area, depending on what part of the country that you're in, or depending on what your role is. We know we have community medical liaisons. We have MSLs that focus in academic centers. We have MSLs that are focusing on clinical trials. And so all these things are kind of woven into the certification process. So having some experience in all those areas and getting some of that experience under your belt, so to speak, will allow you, I think, to be more successful in taking the exam.
Yeah, absolutely. And you think I think these are great perspectives. And you think about like I think about the MSL salary and compensation survey. We've been doing for several years now. And in the beginning, some may have questioned the value of that. Well, obviously, with the all the issues that we've been dealing with, social issues and gender pay gaps and other things over the last numerous years. We now see that the salary and compensation survey last year, majority of MSL managers in the U.S. actually use it as their primary benchmark data. We expect the same thing with the MSL-BC. It's going to take a while to understand the true impact of it, but I think you both just really highlighted the importance of that. And so I think that's really important. I'd like to take another question from the audience. Dawn has said, many professional exams assess entry-level knowledge, and professionals take the exam shortly after completion of a program. Given this exam was developed by MSLs with years of experience, is this exam intended for someone with 3, 5, 10 years of MSL experience? Larry, can you talk about that?
I think all of the above is the initial reaction to that, Samuel, and that like JR, I've been in the industry a long time, and so it was appropriate for me. I think with the caveat where people are ready at different times, people maybe mature in the role at different time frames. I don't think there's a magic number beyond after that first year. That's the guideline where it's a best fit. I think, and we'll talk a little bit more about it, there may be certain situations that may precipitate someone being a little bit more interested in doing this earlier in their pharmaceutical career versus maybe a little bit later. So I think there's no magic number is my assessment so far, Samuel.
Yep. JR, any thoughts on that?
I agree wholeheartedly with Larry. The only thing that I would add is, like every certification, that it starts in the beginning, and as it gets more adopted by industry to become the standard, even though I don't need it, and I've been in the industry for that long, I felt actually will help increase my value and my visibility, my credibility, and my skills for the next level that I'm going to. And I think eventually it will be adopted down the road by many organizations. So to me, why wait till then and not be proactive and take it now and be one of the first to have it and basically be able to showcase my value. And like I mentioned earlier, this is not an easy test. Anybody who takes it is Top Gun for me.
Yeah, I think that's a great point, and that leads me to, I think it's a good transition, and JR, to start with you. Let's talk about, you've taken the exam, and you guys are just being introduced to this. You've been through it, highly experienced, both of you. Why? Like, why are you on this call? Why are you having a preference hiring. So can you talk about some of your reasons for having a preference for hiring MSL-BC credentialed professionals? What have you seen, or what made you get to that point? JR, can you talk about that first?
Absolutely, Sam. I mean, it goes back to the level and the content of the test and the value to me. Even with my year of experience, I gained a lot. I understood a lot. And for me, like I said earlier, anybody who take the test is Top Gun for me, because I experienced that. I went through 4 hours of answering questions that some of them maybe I couldn't answer, but it gave me that level of competence that the next person who take that test and apply for a job, it's gonna be in high regards for me, because I've been there, done it. I know its value. I know the content. I know how long it took me to get it done, and the experience I got and the honor of getting the certification after my title. It all adds to why this is important to me.
Mm-hmm. Yeah, no, and I think that you both have talked about it several times, that anybody who sits for this exam, we've got the feedback from everybody who's been through it that this thing is for real. Larry, what's your perspective? I mean, you know, you're here and got great visibility in the MSL space and leading large teams. Why? What is it that did it for you?
I think, Samuel, it's such a competitive marketplace out there right now, and most people know that there's a high demand for people in our roles, which is a great thing for our profession. And there are so many different nuances to the different roles, like I mentioned before: community liaison, academic focused, maybe in a clinical trial area, and maybe some hybrid of all of those if you're in a smaller company. And many times you get brought into a situation where maybe the PDUFA date is only 6 months away, and you don't have the opportunity to maybe have a little bit of that 18 to 24 month runway that many times we like to have. And so knowing that someone has taken and passed the certification is another great data point. We all like good data, right, in this profession. And so having that as a data point to know that that person has even a better ability to start and get up to speed very quickly, and maybe some of those job specific skill requirements that maybe we have to spend time on, or maybe that multitude of different shadowing visits in the field with a new MSL, maybe we can minimize some of those because of that certification. And we know that those baseline MSL tactics and objectives and criteria have been covered, and there's a good understanding of that. So many of those competing pressures that we're up to now, or again, even compounded more by we're having to interview and hire virtually. And so maybe we're limited to a couple of hours of a live interaction over video, as well as a couple of phone interactions to make a very important decision. This is another important data point that I think will help, as JR said, help us feel a lot more confident in our hiring.
Yeah, and I think more than anything else, and the most simplistic way of defining this is, it seems like a very complex concept, and a lot went into it, and a lot of time and money from a lot of people. But at the most basic level, and I'd like for you both to comment and see if you agree with this, but at the most basic level, what this does is validate one's skills and knowledge. You say you know this information, but this is a way from a third party, independent, highly validated exam from a lot of people that set this criteria. Would you both agree with that?
100%, Sam. Absolutely. When you receive a CV or you talk to people, you still just, your impression is what you're hearing and the example they give you. This exam actually validates what they're telling you on the phone, what they tell you on their CV, that it's not just a template they filled up. It validates actually that they've been in the profession, they understand the role, they pass the test, they understand the content, and they know exactly what an MSL function is. And that actually validates to me that this person is Top Gun and it's ready to be hired.
Yeah, absolutely. Larry, any thoughts on that?
Another word that goes along with validate is value, and we always want to bring value to those HCPs that we're working with. But again, here's a way for someone to bring value to their own growth and development as a career, as well as that you're going to be bringing someone into your organization that has made that commitment, and again, giving you another level of confidence and comfort, if you will, that dedication, that level of importance, and some of those major skills have been accomplished and demonstrated through passing the exam.
Yeah, absolutely. Great point. Here's a comment from an individual. We're getting several comments and questions around this, and I thought some context about how we got here. And I would encourage everybody to go on the MSL Society website. There's lots of resources about the MSL-BC, how it was developed, how we got here. You can download the handbook that goes into a lot of detail of who, what, when, where, why, how, a lot of detail that is all included in that. But this person, Natalie, has said, hi, considering the MSL role is slightly different depending on the size of the company you're in, and thus our experiences will be different, how is the exam normalized to take this into account? And then how many years of experience would you recommend before taking the exam? So let me address that first part, Natalie, and then I'm going to have Larry and JR talk about that. So on the MSL Society website, you and anyone else listening can go in and download the guidelines for MSL activities. That's an important document, took a few years in development, and it's important to understand how it was developed. So when we decided to set out standards for the MSL role, I reached out to PhRMA, which is the Pharmaceutical Manufacturing Research Association based in the US, and they create and write the pharmacode guidelines. I was expecting them to say, we're not interested. I didn't expect a response. But in fact, immediately upon emailing them, they actually replied back and assigned 2 lawyers to the MSL Society. And over a year period, they helped write some of the content for those standards. Then what we did was we, after about a year or so of that, multiple conference calls, we put out an open comment period where initially more than 1,000 MSLs and managers from 70 countries actually contributed to that. From there, we actually created the first guidelines for MSL activities. And from there, we use some of that as a basis for MSL activity, or the MSL certification. And so what we did was we got together all of these industry leaders, in this case, 22 of us, sat in a room over 6 days and actually wrote exam questions. So, and those people were representing both US and global, also representing big pharma, small pharma, medical device, medical diagnostic, and across all TAs. And so it represented a very good mix of everything that an MSL is sort of engaged with. And so your other question is, how much experience would you recommend? You need a minimum of 1 year of experience as an MSL to take the exam. I guess with all of that, it leads me to, one of my other questions that I wanted to ask both Larry and JR, and certainly Larry and JR, if you have any comments about what I just said, please add that. But in addition to that, I want you both to talk about the value of the MSL-BC for both MSLs and MSL leaders. JR, can I start with you on that?
Absolutely, Sam. Just to comment on what you said, if anybody take the exam and see the content and see the level of knowledge that's in it and the level of the question that's been asked, it encompasses anybody, like you said, in that role. It doesn't matter if you're just an MSL or you're dealing with health outcome or any kind of other MSL function. This test covered all of it. So it's not just for a handful of MSL that do a specific role. It's for any MSL who does all the roles, and the tests cover most of them. For the other question, the value is tremendous to me because from my experience and for looking at the test and have taken it and understanding it, it really, as Larry mentioned, it brings comfort and credibility to the role and to the candidate who is looking to get into this role. And 1 year is probably a good start, but anybody who's done 1 up to 5 years should take the test to add to their knowledge, to their development, and to their value, and make them more consistent with their knowledge and their credibility. And let's face it, as this certification become more popular and widely adapted, even our KOL are going to start looking differently at people who have that certification and allow them more access, in my opinion.
Mm-hmm. Excellent. Larry, any thoughts on that?
Yeah, I think again, just to touch on that is really the value is I think multifaceted, if you will. I think seeing the accomplishment or that as another data piece is helpful. I think as JR mentioned, and it's been reinforced a couple of times, is that this exam and certification is really applicable to all of the things that MSLs are doing. So whether you're in oncology or rare disease or infectious disease or cardiovascular, I think there's definitely application to the role that's easily taken from one therapeutic space to another. I think too, for me, being able to realize, and many people on the call, I'm sure, are in the hiring and management role, that we know the amount of resources, time, and money that are invested in hiring, and whatever you can do to minimize that is so hopeful for your time that you can be spent on other things besides interviewing and hiring. And then number two, obviously you're potentially helping your company to maximize their resources by hopefully having a lower retention, maybe in an area where you feel like there's some comfort, or maybe decrease but a potential issue regarding maybe it's a potential performance issue down the road because of some concerns about compliance or whatever. So I think anything we can do to up the ante, create some comfort, provide value to our organization, and get a little bit of a deeper glimpse into what that person is all about that you're hiring is going to provide value, Samuel.
Yeah, excellent. Yeah, and I think that these are great points. And one of the other things that has come up, we've spoke to, I personally have spoke to several global MSL leaders at very large organizations that have talked about the value. Certainly, one of the values of the MSL-BC is we have onboarding, we have ongoing training. And we're very good at product knowledge, disease state training, maybe less the art of being an MSL and some KOL engagement and some other aspects. But what these organizations are telling us is that the MSL-BC again could be a way for an organization to get third-party independent validation of their MSL skills and knowledge, regardless of years of experience, and as a way with a independent, credible third-party organization. Can both of you talk about that? I mean, comment, do you agree? Do you see that as an opportunity as well, and a way to kind of look at this? JR, what is your thoughts on that?
I agree with your comment, Sam. And like you said, there's so much to this role in any kind of disease state that you can learn from. It's very important in our profession to really have not just the integrity and the high ethics, but also the skillful knowledge of what we're talking about. we are a resource for physicians who depends on us every day to bring the right information and the right data so they can treat patients. I mean, we're all out there for the patients. And any information we bring, any skills we add is going to be valuable and a good resource for them. And within our role, just being able to do all that and be able to project that image of that resource and credibility is valuable for our physicians who don't have time in the world to be able to get their own development or attend seminar or anything like that. I don't know how many times people call on me and say, hey, you just attended this meeting, can you fill me in on some of the important stuff? And that's one of our role, is to be that resource that covers everything valuable for the physicians so they can treat those patients.
Absolutely. Larry, any thoughts on that?
Yeah, just to add on to what JR said, Samuel, I think we've seen over the years different organizations or institutions becoming more and more, I don't want to say restrictive, but more and more inquisitive about who are the folks coming into their institutions or to those offices, and what's the training criteria and credentialing of those people that designates them, whether they're part of field medical or depending on what avenue they're coming from. And so this may be another realm where we can utilize the certification as a way to validate the expertise that person has and why it is appropriate for them to be representing a medical function, interacting with folks within their organization or institution.
Yeah, absolutely. These are great points. Excellent. And especially, I think that both of you touched on is, as this thing, the current COVID pandemic that we're in, and access to KOLs and access to institutions, I think is going to be increasingly challenged. And I think this is another way for MSLs to validate and demonstrate their knowledge and skills to institutions and to KOLs as well. Would you guys both agree with that?
Absolutely.
Yes.
I got another question here, and I think I could address this one quickly. Al has asked, as rapidly as the industry changes and adapts, how frequently will the certification exam be updated? And does the certification have an expiration? Will there be a need to recertify or maintain certification? So, Al, yes, as I mentioned earlier, it is a 3-year recertification. So after 3 years, you will need to recertify. The two options will be to take the exam again, which at that point will be a new test form, a new exam, or take continuing education credits. Those continuing education credits, number of hours and activities are currently being developed right now with a large group of MSL leaders. So more information will be coming on that. So that is coming. So we have another question here that Nora has asked: is the MSL-BC limited to U.S. or could be applied internationally? Nora, this was actually designed and developed by multiple global MSL leaders were involved as well. And so, yes, it is intended to be designed globally. Certainly many of the standards in there align with U.S. standards, but as you're probably well aware, many of these are adopted globally, and so it is generally applicable globally. What is the cost? Valerie has asked. As mentioned earlier, it's $450 for members of the MSL Society, $550 for non-members, and that is for 3 years. So again, 3-year recertification process. Aaron has asked, do you plan to develop a module or some way to disseminate the study material in a more comprehensive way. Yes, as I mentioned earlier, we are developing materials, Aaron. Those will be available soon, but just as a reminder, as aligned with industry standards, these are not, will never be required. They are ancillary study materials. They are completely optional, but we will have some more information on that soon. We're getting close to time here, and I just wanted to final comments before we kind of close this out. Larry, JR, any final comments, thoughts that you want to share with any MSLs or managers that are debating about this or questioning, if this is really something for them? Larry, I'll start with you.
I think for me, I guess I would just emphasize if you're on the fence, jump in. I think even though JR and I both mentioned a little level of anxiety, I think you'll be surprised that with some areas of focus and a little additional study, you can quickly get up to speed and be ready. And like I say, the society has developed many resources to help you get ready. So I think definitely encourage people, especially maybe we've got a little bit more time with some less travel over the next several months and kind of figuring out what life's going to look like in this new challenge from how we're going to do business with more virtual engagements, that we may have a little bit more time to devote to preparing, then go for it and again, make yourself better and make our profession better and hopefully maybe your organization better, including in all three of those areas.
Excellent. JR?
I totally agree with Larry. And the other thing I would add is encouraging anybody who is thinking about it to actually do take it. From my experience, and I know Larry touched on that, taking the test, it brought to me a lot of value and a lot of comfort in knowing that I'm on the right path and I'm actually adding more to my skills. And as a hiring manager, it will definitely add more value to me and comfort when I'm hiring individuals who have the certification, knowing that they've been through exactly what I have been and being comfortable with the role that they're going to be taking on. And when it all comes to be the same, somebody with certification obviously is going to trump.
Excellent. Well, thank you very much, both of you, for your comments and candid feedback. For all of you listening, I got maybe 3 or 4 more minutes that frequently asked questions that many of you have asked and we consistently get. So I'll quickly go through those. And so here they are. Frequently asked questions, and there's the URL to get information on this. We are constantly asked, is this thing accredited? Like, what is this thing? So here's the thing about accreditation that you need to understand. There are 2 sets of standards and 2 national organizations in the US that set standards for a certification. That's really important, not a certificate. A certificate is a training program. Certification is an exam. So there are 2 organizations that accredit certification programs, NCCA and ANSI. In order to earn accreditation for a certification, as you see here on the screen, you need to have at least 1 year of the exam being launched and 500 candidates. We are not there yet. We are absolutely going for that. And I will tell you that throughout the years of development, we were in constant contact with ANSI on meeting the accreditation standards. So the MSL Society was constantly in contact, and the MSL-BC has been designed in accordance with all of those industry standards. The other thing that we get asked a lot, are there other accredited board certifications for MSLs and medical affairs? No. Neither NCCA or ANSI have accredited any program as a board certification for MSLs or medical affairs, and it's because there's no one that has met those standards for a certification. And so if you want to know more about what that actually means, what is a certification, I would encourage you to go to NCCA or ANSI to learn more about what they actually accredit for a certification. Again, not to be confused with a certificate training program. So just want to make sure that everybody's clear on these terms. How do we compare to other programs? Well, there is none. So there is no other certification for MSLs. And so the MSL-BC is the only board certification program that has been designed to meet the stringent certification industry standards. And again, according to the NCCA and ANSI. And so I just wanted to share some more information on all of this information can be found on our website. I would also encourage you to go to both the NCCA and ANSI websites. So that kind of takes us to last thought is what's in it for me? Like, what are some of the benefits? We created a really cool PDF document that highlights 5 of the most top 5 benefits for earning an MSL-BC for MSLs and managers. On here, there's a lot of testimonials from MSL leaders, and so I would encourage you to go check that out. You can download the PDF there on that website. Ultimately, here's sort of one of my final slides here. What is this? Why are we doing it? Again, in very, very simple terms, the MSL-BC is a board certification exam. And what this does is allows MSLs and managers to validate and demonstrate their skills and knowledge that is set on a specific criteria determined by a large independent panel of MSL leaders that were very involved every single step of the way throughout the multiple years of the process. So with that, certainly encourage you to get more information. Certainly, if anybody has any questions, certainly you can reach out to me. I'm going to end it there, and I apologize for the technical snafu in the beginning, but I think we got through it. And once again, thank all of you for being here. JR, Larry, thank you very much for your candid input. And certainly we feel like that this is something that we can all be very proud of, that we have something that begins to set industry standards for our profession, and certainly something that will raise the professionalism of our profession as we grow and go through very obvious changing times as we develop. So everybody, thank you very much for participating. JR, Larry, thank you very much.
Thanks, Sam.
Thank you. Bye.
Bye.